Today we will see about the tuberculosis, how to make a concept mapping and mind mapping. Last video we have seen about the respiratory problems, right? Clearly see anatomy you have to review and how you can draw the picture of respiratory system and list down what are all the topics and common nursing diagnosis you can write. Same way, it's so difficult if you are reading the big book. So you can take mind map or concept map, you can make each one disease condition. Today's class, I'm going to teach you about one disease condition, how you can make a mind map or concept mapping. Today we are going to see about tuberculosis. You put one round, write TB and write the definition of tuberculosis. You write it very simple definition. TB is an infectious disease caused by the Mycobacterium tuberculosis. It is the formation of tubercles and bacillus in the lung parenchyma. That's all about the tuberculosis. See how to make a mind map and concept map of this disease. In one glance, you could see what are all the disease, what is the pathophysiology, what is the signs and symptom, what is the incidence rate and everything. If you see the TB, in the introduction, what you can write? 1/3 of the world population is affected by the TB. In that 1/3 of the population, more than 50% of the population TB affected persons are in India. Some statistics you can put it over here. If this point you remember when during exam time, you can write the synopsis introduction, keyword you can remember this. What about mode of transmission? 85% of the TB are transmitted from the airborne, right or not? The remaining will be extrapulmonary TB are transmitted. Oh, how this mode of transmission? You can just list down. Mode of transmission, you can list down droplet infection, ingestion, inoculation and transplacental. It's a very, very rare. Transplantation placental is very rare. Droplet is the main thing. If you see, then with this, how it is coming 85% you have told. So what is extrapulmonary? 15%. All these things you can write it under the, put one arrow mark, you can write lymph nodes it's affected, gastrointestinal system, GI system. How GI system TB will be affected? Because some of the people will be drinking the raw milk which is extracted immediately from the milk. The breast of the cow may have this tuberculosis. So they develop the bovine tuberculosis. From this TB in the stomach or any intestine through the blood vessels, it will go secondarily to the lungs. Understand? Then TB also will affect the bones, joints, intestine, skin, TB spine, CNS. When it is affecting CNS, it's called meningitis, TB uveitis, TB osteomyelitis and spleen, liver, peritonitis. Also joints, it's called arthritis. TB spine, it's called Pott's disease. So how we have done? TB, introduction, what you can write? Mode of transmission, site of infections or accordingly it will be pulmonary and extrapulmonary. This is the mode of transmission. What are all the risk factors to develop this disease condition? The risk factors mainly poverty, overcrowded area, malnourished children, alcoholism, smoking, drug addicts, then sometimes immunosuppressant people, transplant people, kidney diseases or any other diseases may very high risk factor to develop this disease, right or not? So this is all developing, like these are all the risk factors, how it is entering, that is called pathophysiology. This from the TB pathophysiology. How this, what is this? Bacteria enter into the lungs, it reaches the apical part of the lung. Then will be what is happening, any foreign body entering in fact into the body, what will happen? Immediately antigen antibody reaction that will be engulfing the bacteria. Sometimes it will be kills the bacteria and formulation of the granuloma. This granuloma tissues will be having collection of fluid, sometimes will be there, then healing will be called granuloma. This collection of fluid by after engulfing or the fight between the bacteria and the WBC, what will happen? This fluid also will be having a dead as well as the live mycobacterium. Correct or not? Then this killed bacteria, afterwards it will be forming. Then what will happen? Release of a lymphokinase and at last calcification will be taken place. If you see in the lungs, calcification. It is in the X-ray you can able to see this one. So this is the pathophysiology is mainly happening in the lung parenchymal tissues. So what is the signs and symptom? Keeping all this in mind, in the algorithm you can bring it in a mind map and concept map. What are all the major signs and symptoms you can write? fever, night sweat, fatigue, loss of appetite, chills, productive cough, hemoptysis, blood in the cough, and then pleural effusion, dyspnea, then orthopnea. So these are all the main signs and symptoms. There will be night will be the increase of the fever. Understand? So when this from the apical part of the lung, that's then it is spread throughout the lung. It's called the miliary tuberculosis. So if you see the types of tuberculosis, we have seen according to the site of infection, we have seen it is a pulmonary and the extrapulmonary. According to the type, it is a primary tuberculosis, miliary tuberculosis, progressive secondary tuberculosis. Why it's coming at the secondary? Because of HIV and other infections, it will be coming. And then TB, emphysema, and fibrosis tuberculosis. So these are all the major types. You can able to remember this one. The other side, according to sites, pulmonary, extrapulmonary. So we have put it into this algorithm. So with the pathophysiology, you can write the signs and symptom. Okay, with the signs and symptom, what is the diagnostic measures? Of course, every diagnosis should be made by the history collection. That's a normal one. Here main thing, sputum, bacterial, culture PCR, ESR, X-ray. In everything, you have to go for some confirmative test. So you will be going for the Montax test or the blood test assay. You will be going this assay. And then these are all the diagnostic measures. Confirmative Montax test. What is Montax test? Montax test is a PPD, like a purified protein derivatives, 0.1 ml taken in the left forearm. It is injected by intradermally and marked by the red pen and waiting for 42 to 74, 48 to 72 hours they will be waiting. They will be looking for any induration, itching, edema, swelling, all these, any color changes, reactions in the skin test will be the confirmation test for the Montax test. That is the one. And about what are all the management? Management will be the medical management, chemotherapy. Medical management means mainly chemotherapy. Chemotherapy you have to, what is the first line drugs, second line drugs, third line drugs, and mainly in the government are giving the DOTS, through the DOTS program, direct observation treatment of short term courses. Now you no need to wait for 6-month courses. They are giving incentives, 1,000 rupees, who is taking care of the patients, and then it will be motivating them. Within 3 months, TB is getting reward. It is not anymore killer disease, and as a preventive measures, BCG is the vaccine given to as a prophylaxis to prevent the future generation to affected from the TB. What about the nutritional management? The medicine alone is not going to cure about it. When you take more amount of medicine, equally the metabolism, the liver does need many things, is the correct amount of the food. What kind of a food you have to take? It's like a protein rich food, like 2 eggs, meats, meals, and small and frequent food is very, very important. Highly nutritious protein rich food will be helpful for the TB patients to get rid of the TB. Then will be chemotherapy, Ayush. Ayush also, what kind of Ayush you can, these respiratory illnesses, mainly you can go for the what kind of spirometer you can give, or spirometry like a toy you can give. There will be a colorful balls, and then lung expansion exercise and some pranayama. Pranayama will be very good to expand the lungs, and the positive therapy you can give them. Positively you can reinforce the patients, and the hygiene and mental health and mental positive approach and mental well-being and counseling you can give it to the TB to prevent the further damage. So what I want to tell you, this is an example I have given you in a respiratory system. Same way, this method you can follow in asthma or pneumonia. You can write the type of pneumonia, how is the pneumonia affected, what is the mode of transmission, how the pneumonia is kind of this one, what is the pathophysiology of pneumonia. Like that you can make one mental map and concept map of the disease. Now I wrote only Montax test, but you should know how to elaborate the Montax test. So it's like a connections, and Oromark will be connecting with each other, and this is a bird's eye view. Rather reading the book for your exam time, this kind of a notes will be very much helpful, because you are creating, you are completely involving. in a big structure you are learning, and you are bringing into the pictorial form. So you more conceptualization, and your brain is analyzing about this big topic into the short algorithmic form. So your brain capacity will be improving, your involvement will be good. You might have a doubt, "Oh, how this is a very vast, how will I able to make a notes for all this?" Each system you make it. That's our first respiratory problems I made. No, like anatomy, just read one, review the anatomy and draw the respiratory system, and or if it is a digestive system, draw the digestive system where it is static, and each where digestive system, what all the diseases can come. Then common nursing diagnosis. For example, this respiratory we have seen in the respiratory problems, what are all the common nursing diagnosis, like impaired, whatever the breathing difficulties, whatever it may be, you will write that 4 important one, that will be the common for the peptic ulcer, means what all the things will be coming. Okay, so that is how you have to make a mind map or the concept map for the each topic in a very, very creative manner. Though it is taking 2 or 3 hours, but once you read in lifetime, you will remember about the tuberculosis. Additional information can be added somewhere with your pencils. You can mark somewhere. Thank you.